A nurse is a nurse is a nurse. At the end of the day, whichever type of nursing you do, you still care for people in their most vulnerable moments, and that is what makes nurses so special. What's up, guys? Welcome back to my channel. For those of you who are new here, I am Jane. I'm a wife, mother, nurse, and fellow human figuring it out as I go, and I am documenting that on YouTube. If you haven't already seen it though, please go back and check out my last video where I talk about my first official month on YouTube. The ups and the downs, all the good and the bad, just really exciting. And also, if you haven't already, please subscribe, like, and share. Hit that bell so you don't miss any of my videos. But today I'm covering a topic that I feel many nurses have considered throughout their career, and that is home health nursing versus hospital nursing. I have worked both, and this is of course based on my experiences and my personal opinion. So I'm coming at you with the pros, the cons, the good, and the bad of both. So let's get into it. Typically, home health nursing involves you seeing patients in their home. You're collecting vitals, you're doing medication management, insulin administration, wound care, you're setting up IVs, and providing education for both patient and oftentimes their family. And then for hospital or bedside nursing, this of course involves much of the same. However, you're typically doing this 4, 5, 6, sometimes 7 times over with 7 patients in an acute setting. So if you're watching this and you're debating on whether to go into home health nursing or work bedside, I hope this video will give you some clarity. So first, let's chat about the pros and the cons of bedside nursing. What are the pros? What's the good stuff? So one major advantage is you learn so much in bedside nursing. You learn so many skills, some of them highly specialized depending on what unit you're on. IV insertion, NG tube insertion, laryngectomy care, how to draw blood, pre and post-op care. You're gonna learn and see so much. And on top of that, you interact with so many different disciplines. You get to see what the OT does, what PT does, what wound care nurse is doing, and this indirectly increases your knowledge base and foundation. If you thrive off of challenging situations where a bunch of things are being thrown at you, the hospital is full of them and it's definitely the place for you. Another pro is that bedside nursing is great for professional development. I feel that you're way more marketable. Usually the hospital will offer training, various courses. Sometimes the hospital will offer bursaries and scholarships for continuing education. So it's really great if you're a nurse, let's say you're an RPN or an LPN and you want to bridge to RN. Some hospitals have the funding, the resources, and particular programs that will help you do that. So that's really, really cool. Another advantage of bedside nursing, I would say, is the pay. In my experience, in terms of hourly wage, hospitals typically tend to pay more compared to home health nursing. They offer shift differentials. So for example, you can make $1.75 more per hour if you're working evenings or weekends. You can also pay into a pension, which is really excellent for planning for retirement and for the future. The pay is also consistent. You know you're getting this much money every 2 weeks and you can budget your life and finances around that. And that's very attractive for people who have commitments that require that type of consistency, like a mortgage or children. Consistent pay makes all the difference there. Also, you learn to work with others. You refine your skills on being a team player. You can really master communication and how to navigate different communication styles. Another huge pro is the scheduling. Bedside nurses typically work 12-hour shifts, so they usually work a full week's worth of hours in 3 shifts. And this means they will usually get a chunk of days off. When I was doing the 4 on, 5 off rotation, it was great because it gave me the option of going away or taking a vacation and not having to use any of my PTO or paid time off. And even, if you do have to use your PTO, you're only going to have to use 1 or 2 days. And also that 5 days off always felt like a vacation. It was a good amount of time away from work. It allowed me to mentally reset, rest, and recuperate. The scheduling was great. Now, what are some cons that are associated with bedside nursing? First, I will say that bedside nursing is physically, mentally, and emotionally draining. The hours are typically long, and from the moment you clock in, it tends to be nonstop. There's definitely an increased risk of burning out when you work in the hospital. We know that nurses wear many hats. You're a nurse, but you're also the physiotherapist, you're the occupational therapist, you're the social worker, you're a therapist, you're the technician when the patient's TV isn't working. And this can be a lot when you're doing it 5, 6, 7 times over for 5, 6, 7 patients. It can take a toll. I have been in a rotation that was 4 on and 5 off, and although I just mentioned that the 5 days off was absolute heaven, working 48 hours in a row was heavy and my body was just worn by the end of that rotation. So that's a huge con for me, the workload and the potential for burnout. Another major disadvantage, carrying out orders and getting things done can be complex and multi-step.
And it can take forever.
It's like getting from point A to point B can be very complex. In an ideal world, you get from point A to point B. No problem, no issues, like the image on top. But with bedside nursing, it's more like the bottom image, okay? You're all over the place. And I'm gonna give you a scenario. In a perfect world, you get an order to hang IV antibiotics for your patient. You get the medications from pharmacy, you hang it, it infuses, all is well, you document it, and you're done. You've actioned that order and you can keep it pushing. But in the real world of hospital nursing, it's more like you get the order for antibiotics, okay? You call the pharmacy twice because it's been 2 hours and it still hasn't been delivered. So you let them know, I don't have the medication, but they let you know that they are swamped and they will send it as soon as they can. So now you're waiting. You go to update that patient of what's going on, and you notice that the previous nurse left the IV line uncapped and it's been sitting on the floor collecting all of that great bacteria. So now you have to change all of the tubing. But of course, your unit is out of tubing. On your way to the neighboring unit to get new tubing, your phone goes off. Family member of a patient wants an update. You go back and you do that. You finally get the tubing. You get it ready. Pharmacy has finally brought up that medication. You go to hang it, but your other patient is calling, telling you they feel nauseous. You deal with that. Now you're on your way back to your IV patient. Your phone goes off. The doctor is calling and wondering why your other patient hasn't gone down for MRI. You call imaging and surprise, they're swamped too, and they tell you they'll get to that patient when they get to that patient. But of course, the doctor is annoyed with you because you're the nurse. Why wouldn't the doctor be annoyed with you? You finally get back to your patient, you hang the med, you infuse it, done, order actioned. And guys, I know that scenario felt like it went on forever, but imagine living this out for 12 hours, live in living color. That is truly what it's like in the real world of hospital nursing. You are constantly juggling things that are many times out of your control for 12 hours. So getting from point A to point B isn't linear, and that can be a lot. Another major con of bedside nursing, I'm just gonna come out and say it, is in-unit drama and politics. Like I said, day to day, you are interacting with so many people, so many personalities, and so many different ways of communicating, and this just increases the potential for drama. I've witnessed gossiping, whispering behind people's back, and just some really petty things. Now, of course, this is not every hospital unit. If you're lucky enough to be working on a unit where everyone shares that mentality of this job is hard enough without added drama, then I love that for you. However, you will find that there's a potential for drama and politics on many hospital units, and this is a major, major drawback. Like I said, bedside nursing is stressful enough without the added nonsense. So yeah, that's a major turnoff. So those are some pros and cons for hospital or bedside nursing. Of course, this is not an exhaustive list, but things that I can think of based on my own experiences. So now let's get into home health nursing. The main difference here from hospital nursing is you are typically seeing patients in their home. You are going from home to home and providing nursing care there. You're often hired by an agency, and then that agency is responsible for sending you out to different patients. Well, in the outpatient setting, they're not called patients, they're called clients. They will assign you your caseload within a certain geographical area, and you're expected to see these clients. Now, the agency and your agency coordinator is something like a governing body. They're going to tell you what to do, where you need to be, for how long, and what time you need to be there. If you need recent orders, you're contacting your coordinator. If the patient isn't home when you arrive, you're contacting your coordinator. If there's been a change in the patient's clinical status, you're notifying your agency or your coordinator. So the agency here is very much like Big Brother, overseeing what you do, and you will report to them for everything. So in terms of the pros of home health nursing, what's the good? The biggest pro for me when I was working as a home health nurse was flexibility. So usually your agency will give you full control over the hours and schedule you work on a daily and weekly basis. Most agencies allow the nurses the autonomy to work as they see fit, as long as all of the visits are completed each day. So if you know Mr. Smith likes to be seen first thing in the morning, you have that flexibility to move things around to accommodate that. Sometimes I would have clients living in the same apartment complex or building. So I would start an IV on one patient, and while it was infusing, I could run, just next door or a couple floors up and see another patient for wound care. Or sometimes I'd be scheduled to see a client. I call her and she says, actually, can you come change my wound dressing tomorrow? And I'd say, no problem. I just move her visit to the next day. So having this flexibility allowed me to schedule time for lunch, personal appointments, and anything else I wanted to get done during the day. It was really nice to be able to set my own hours. So the flexibility piece in home health nursing was huge. So another pro here was the opportunity to connect with my patients on a deeper level. So unlike the revolving door of patients that is hospital nursing, they're in and out, in and out. When you work as a home health nurse, you can form deeper connections with your patients and their families. You can really get to know them holistically, see the whole picture. And also seeing them in their home can provide another layer of insight into what you already know. We know that a patient's home or environment can oftentimes be an extension of themselves. So a very clean environment versus a not so clean environment may give you some clues as to how they're feeling mentally. If you're seeing a patient for PICC line management, let's say, where that risk for infection is greater, you look around and their environment isn't the cleanest, then you know that you're going to have to reinforce teaching about the risk for infection. So yeah, I really liked that about home health nursing. I felt that I really got to know my patients and their families, and you just formed deeper connections, and it made that nurse-client or nurse-patient relationship that much better. The next major advantage I found with home health nursing was the pay. Now, this one is interesting because you recall that I mentioned that the pay in bedside nursing was a pro. However, for home health nursing, the pay is both a pro and a con. But in terms of it being an advantage, when you work in home health, you can make a lot of money, okay? You don't get paid by the hour, you get paid per visit. So let's say you're making $31 per visit. When I did home health nursing, typically they would allot 1 hour per visit. However, the more experienced I became, the faster and more efficient I was. So what used to be a 1 hour visit, I could do in 30 minutes. Then I could do that with the next patient and the next patient and so on. And so what would have been $31 an hour ends up being $62 an hour. And honestly, some of the more seasoned nurses I know, they were making something like $100 an hour sometimes. And then you get so efficient that you finish your day early. And then there's potential for overtime. You can pick up extra visits should they have that. But honestly, there were always extra visits because that's just the state of nursing right now. So you can make a lot of money in home health nursing. Another major advantage for me working as a home health nurse was the independence, working by myself. Now, of course, nursing is interdisciplinary, right? So you're never really alone. You may have to communicate with other members of the team. For example, if they have personal support workers coming into the home, you may have to coordinate your visits with that service if the patient is on, let's say, a bowel program. But I was working independently in the sense that most of the time I go in by myself, I provide my care, do my documentation, and I'm on my way. I get on my car, I turn on my music, I have my coffee, and I just cruise. And it was great. So I think this is really attractive to people who may feel that they don't thrive as much on a team and they work better alone. When you work in a hospital, you don't stop talking. Seriously, it's just like blah, 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 blah all day. But in home health nursing, things are much quieter and this can be nice. So now the cons. What are some disadvantages of working as a home health nurse? First, even though I just mentioned the pay as a benefit, it's also a disadvantage because of the lack of consistency. When you work home health nursing, yes, you can make a lot of money, but in order to do that, there has to be clients for you to see. So yes, sometimes these clients are on service for a very long time, so you have that regular source of income, but oftentimes patients recover, so they come off service. They're admitted to the hospital following an illness, or unfortunately, they pass away. And when that happens, unless your coordinator is able to replace that visit, you're just left without those hours or that money. So that lack of consistency can be really tough as opposed to working bedside where you know I'm guaranteed to get this money if I show up to work. The lack of consistency was a major drawback for me. Another disadvantage I found was unpredictable environments and safety risks. When you're working out of a patient's home, whatever is there is there. Sometimes you get there to do wound care and there are a limited number of supplies, or you need to start an IV, but the patient's son didn't pick up the supplies from the pharmacy, so you can't do anything but come back the next day. Unlike in a hospital where everything you will ever need is more than likely in the supply room, when you're working out of a home, there are limited resources and sometimes you're just forced to work with what you have. Adding to that, you just don't know what you're walking into. I will never forget one of my very first home health nurse shifts. I went in to see a young patient to change her ostomy and teach her, how to care for it. However, it was not noted on file that she had pets, okay? She had a cat, which I typically don't mind because cats just mind their own business. They don't really bother you. But this cat had 8 kittens, 8. And for those of you who know what kittens are like, they want to play, they want to explore, they want to jump all over you. So here I am trying to change this young patient's ostomy and teach her about signs of infection. And I have a kitten swatting at my scrub pants, another kitten trying to get on the table, the mama kitten not taking her eyes off of me to make sure that her babies are safe. I was so uncomfortable. And she had already taken off her ostomy appliance just before I got there, so I couldn't just leave her with it exposed. I had to suck it up and get it done. And that's what I did. I got it done and I left so fast, but you better believe I told my coordinator to never send me back. So although you can list your preferences with your coordinator when you work as a home healthcare nurse, like don't send me to a home where smoking is present or no pets because of allergies. You just never know what you're walking into, and that can be scary. The safety risks are a drawback as well. Sometimes patients are unstable or can have responsive behaviors, and this can be scary, especially when you're alone. Or sometimes it's not even the patient, it's their family member who's being verbally aggressive or making you feel uncomfortable. And these are things you have to learn to navigate on your own. So that was a major disadvantage for me. The last disadvantage for me was the amount of travel involved. Of course, when you go into home health nursing, you know that travel is a part of the job. But if you are unlucky and you don't get a coordinator that schedules your visits within the same vicinity, sometimes you're driving all over the city and going back and forth and up and down, and you're doing this in inclement weather. And as a nurse, you're expected to see your patient rain or shine. On top of this, you're putting mileage on your car. So having a car isn't a must for home health nursing, but it's definitely recommended. So you'd be doing a lot of driving. And if you don't enjoy driving, I don't know how much you'd enjoy home health nursing. There you have it, guys. Those are my pros and my cons for hospital or bedside nursing versus home health nursing. Both are great in their own ways and both have drawbacks too, but either way, both types of nursing can be very fulfilling and you will gain great experience in whichever field you're in. So if you're watching this and you're stuck on which path to take, I hope this video and my experiences have given you some insight. If you're a fellow nurse who has also worked both, leave a comment. Let me know what you liked about both and what you didn't like. I'd love to read it and I know others would like to read it too. I want to end this video by saying a nurse is a nurse is a nurse. At the end of the day, whichever type of nursing you do, you still care for people in their most vulnerable moments, and that is what makes nurses so special. Thank you so much for watching, you guys. I will see you in the next video. Bye.